My name is Cedric Hermans. I'm currently heading the Division of Hematology as well as the Hemophilia Treatment Center at the Clinique Universitaire Saint-Luc here in Brussels, Belgium. Well, I think that to fully capture this concept, you need to understand the basics of hemophilia. Hemophilia is an inherited bleeding disease with factor VIII or factor IX deficiency. We will focus on hemophilia A, factor VIII deficiency. And because of this clotting factor deficiency, persons with hemophilia will bleed. They will mainly bleed in their joints and their muscles. So what are the consequences of these bleeds? This bleed will result in pain, function limitation. And if all these bleeds are not well treated, in the long term, they will lead to major physical limitations and even disability. So clearly, hemophilia has a major impact on your body, a major physical impact. But also hemophilia is impacting on your mind, on your brain. It has a lot of mental implication. Because of hemophilia, you get pain, but you get also a lot of anxiety, a lot of fear. You cannot have a normal life if you have hemophilia because of all this physical complication. What we have seen over the last few years is the development of new drugs, new treatments. If we look at the physical impact of this treatment, well, these new treatments, they really have a major impact on the bleeding symptoms. We know that in most patients, we won't see bleeds. So that means that patients will not longer be confronted with bleeds, with pain. But besides this physical implication, this new treatment also have a major mental impact. You know, if you don't have this pain, if you don't have these bleeds, if you have a treatment that is easy to deliver, a treatment that has a persistent effect, that does improve your blood coagulation steadily, constantly, well, clearly you can have a totally different life. And we call this being hemophilia-free mind. So that means that you are not only physically liberated from the disease, but also mentally. So that means that when you wake up in the morning, you don't need to think about hemophilia. You don't need to think about the implications of hemophilia and about the treatment of hemophilia. And this will be for the entire day. Maybe one day, maybe 2 days, maybe a week, maybe several weeks. This is the mental liberation of hemophilia. Well, I think this is, being hemophilia-free mind, I think this is really the new ambition of hemophilia treatment in hemophilia care. Yes, being physically liberated, I think this is important. But if the patients can have a normal life themselves, as well as their partner, their children, their family, their colleagues at work, because the mental burden of the disease has been minimized. I think this is what we should look for. And this is really the new ambition of hemophilia treatment. And the new treatments that we have today allow us to fulfill this ambition.